This is St. Louis on the Air. I'm Jonathan Ahl, in for Sarah Fensky. Flourish St. Louis is an initiative working to reduce infant mortality in St. Louis. The organization received the 2020 Launchcode Moonshot Inclusion Award for their community-led approach to improving the health of Black moms and babies. Here to talk about the program are Kendra Copanas, Executive Director at Reignited Health, and Mia Daugherty, member of the Flourish Community Leaders Cabinet for home visiting. Kendra and Mia, thank you so much for joining us.
Thank you for having us.
Good afternoon.
Less than 2 years ago, the staff behind Flourish set a daring goal: eliminate racial disparity in infant mortality by 2033. Kendra, you called it the organization's North Star.
That's right. Flourish started about 5 years ago, and after a few years, we came to better understand the data about what's driving infant mortality, where the most pressing needs are, and we learned that the gap, the disparity in infant mortality between Black babies and white babies had been widening. And if we wanted to see a reduction in infant mortality, the most important thing we could do is focus on improving and eliminating that gap for Black infants and Black moms. And so we set a bold vision, and we called it our North Star, that's going to be our heading for 15 years, so that we could stay true and focused on that big goal. And we believe it's achievable. And so I say it's our own moonshot that we've set to reach by 2033.
It seems like a lot of people who are from privilege don't understand the challenges that young moms, that Black moms and their babies face. Can either of you kind of tell us a little more about some of the misperceptions that people have and think that don't exist?
Yeah. Yes, I can speak on that. When I first joined Flourish and learned that, which it was eye-opening for me to learn that I lived in the zip code in 63107, which is one of the highest infant mortality zip codes in St. Louis. When I learned that where I reside, that Black babies are, there's a very high chance that child would not see their first birthday. It was heartbreaking for me to know this, and to also know that the healthcare providers that are within the community, that the disparities that the communities face, knowing that there is healthcare with that, that their businesses are easily accessed, but they're not receiving fair treatment from those places. So when I was pregnant and it was time for me to give birth to my daughter, I almost put my daughter's life at risk because I did not want to go to the local hospital that was closest to that zip code. And I wanted to bypass it. I didn't want anything to do with it, but I had to put my daughter's life first and say, okay, I just had to put it in God's hands. But being a resident in that area and to understand that there is no area to get fresh fruits and vegetables. The way that I see it, it is a food desert in that area, to where it's easier to access greasy, fast food, unhealthy items than it is for you to get a fresh salad.
So you mentioned healthcare, access to healthcare, access to proper nutrition. What else is adding to this problem?
Jonathan, I think it's important to frame this as this issue of infant mortality is bigger than just healthcare, and it's bigger than individual behaviors of moms and families. This is about every system and structure in our community that moms come into contact with across their life. So it can be the institutionalized systemic racism that exists in every aspect of life in St. Louis, accumulates in women's bodies. And we see that this accumulated stress and trauma has an impact on birth outcomes, increasing the risk of preterm birth, low birth weight, and infant mortality. And we keep coming back to this as the core because data shows that this disparity between Black babies and white babies remains, whether you have all the resources and access to resources in your life or you don't. That it isn't just about under-resourced neighborhoods, though that has dire consequences, but this is affecting women of all economic and education levels, that women of color are at greater risk. And so we're really focusing beyond healthcare, and we're focusing beyond individual behavior to what are the systems and conditions in our community that need to better support and care and provide, allow the opportunity for all Black women to thrive and their families to flourish.
Kendra, if this is a symptom of a widespread set of community problems, then how do you tackle that when there's hundreds of things that are contributing to Black moms and Black babies being at unnecessary risk? Yes,
that's been a challenge to know where to start. What our Flourish Community Leaders Cabinet has done is we've looked at all of the data together. And that includes a lot of listening to community members and to families who have experienced the kinds of challenges and things that Mia talked about and more, to see what are the most important things that they feel if we could address would make a difference. And so we have a set of priorities the community has determined, and that's where we're focusing. One is to make sure that Black moms have access to a range of coordinated quality care that's designed for their equivalent prenatal care, doulas, home visiting, all of those kinds of services.
I know another area that may not come to top of mind, but is definitely part of Flourish's efforts is on transportation. Mia, can you address that? Mia, are you still with us?
Yes, I'm here.
Okay.
Could you repeat that?
Sure. The transportation, that's something that people may not think about when they think about infant mortality, but I understand that is definitely on the forefront of Flourish's efforts. Can you speak to that?
Yes, we, as community members, we have come together and they have expressed that the transportation to and from doctors' appointments have not been the best, especially to the moms that need the transportation the most. When it comes to their postpartum visits, when it comes to their babies' visits, the transportation has failed the community numerous times. We had one of our community members speak about how she was trying to get to her appointment and they did not show up. No one was held responsible. There was no place where she could have filed a grievance or voiced her opinion. They just did not show up. So she made another appointment. Transportation did not show up. The mom was hotlined. The mom was hotlined because it looked on her end as if it was neglect.
What does that mean, hotlined?
Children's division was called when a child is abused or neglect. A parent is hotlined, but the mom, the child was not abused. The child was not neglected. Transportation failed the mom twice.
And that lack of transportation, then not only does it keep her from getting to the doctor, it also puts another negative check mark next to her name, which makes it even harder for her to be successful.
Exactly. And you have, as Kendra stated, you have moms that are dealing with an unimaginable amount of trauma, whether addressed or whether not addressed. But you also have to add postpartum on top of the trauma. So situations like that is just one example of what is adding an additional layer to someone that is going through postpartum.
The 2020 Launchcode Moonshot Inclusion Award must mean a lot to you. What do you think that will be able to do for your efforts in getting more accomplished through your work?
Well, I will say one thing. I was so excited to be a finalist. Being a finalist means that we are being heard, that we are being seen, that we are being recognized for our work. But for me when we received that award, to be an actual recipient, I could have passed out when they called Flourish. I could have just hit the floor, because we, as community members and Flourish, we have been doing groundwork to get this message out there that Black babies matter. That is what our shirts say, Black babies matter. It meant so much to just have us in the forefront and to be seen, and for those questions to be asked. Why are Black babies dying? So now those questions are being asked. Why? And also to bring, for the biggest part to me, is bring an awareness. To bring awareness to those particular communities, but to also bring awareness to those that have the ability and the to bring change, the change that needs to happen. It has to happen.
And Kendra, what's next then with this recognition that the organization will be able to do?
Wow, it is really exciting for us to be recognized, as Mia said, because one of the things we've tried to do in getting the message out is let people know this is bigger than just a healthcare. This is a whole community issue that everybody needs to take part in. And for Launchcode to pay attention and recognize this issue does start to demonstrate that we are being inclusive, and the message is getting out that we all have a role to play. So I think this is it also helps us stay really focused and inspired on our North Star, that we can keep focused on that and shoot for the moon. And I think it's an opportunity for us to, as Mia said, bring more awareness and more people into this work, because this is going to take a lot of effort by a lot of people. And so we would love to have more people get involved as a result of this.
Kendra Copanas and Mia Daugherty, thank you so much for joining us today. Congratulations on your award, and good luck in the work that you continue to do.
Thank you so much.
Thank you so much. Thank you.
This is St. Louis on the Air on St. Louis Public Radio 90.7 KWMU.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.